baby safe in a baby carrier? Here's some things you need to know. I'm Dr. Olivia. I'm a developmental physical therapist. I'm the Baby PT on all social medias. Make sure you're following me there. We're gonna get into some of the things that I look for when I'm using a baby carrier, some things I tell my moms to look for when using a baby carrier, because I love a good old baby carrier, but there are some things that I really wanna focus on in today's video. So let's get into it. I'm gonna be using one of my favorite baby carriers, but these apply to any and all baby carriers, slings, all of those things we wanna be mindful of. So let me put on the baby carrier, let me get my boy Prince Carlos, and we'll demonstrate some stuff. Okay, so the first thing I wanna talk about while I'm putting on my baby carrier is your baby's hips when we're in a baby carrier. So the hips, especially before 6 months, are a really fragile and not fully developed joint. So when we're in a baby carrier or a sling or any of that where their legs are kind of suspended, we want to prioritize the hip position over anything. Because what happens, or what we don't want to happen, is for them, the hips to form in a different position or get hip dysplasia or dislocate or anything like that, which is unlikely. But if you use a baby carrier frequently, you know, over time, these things can happen. I've seen it all the time. So I want you to be mindful of that. So the M position is the position your baby's hips need to be in when they're in the carrier. So the M position is your baby's hips are sitting lower than their knees. So their knees are hiked up and really wide, so it makes an M position. And I'll show you with Prince Carlos here. Okay, so the M position, I'll show you right now. And obviously this is not how I want you to put your baby in a baby carrier, but I'm just showing you with Prince Carlos. And I'm gonna make it really exaggerated too, and if we need to, I can always put an overlay picture of what I'm looking for with that M position. So again, it's all about the hips. And a lot of times the babies, when I talk about the M position, it seems counterintuitive because of how wide their legs are in the baby carrier. So they should be almost essentially wrapped around you. So again, guys, this is kind of a quick thing, but I think you can see the M position I'm talking about. So the butt is low, the knees are bent, and they're higher than the hips or their butt. This is the most natural position for your physiological hips to sit in. So again, guys, we want to protect the hips at all times. The tendency I see a lot with baby carriers is, for one, the whole device sits way too low. But a lot of it too is their legs look more like this. And again, this is really exaggerated, but they're shooting down and they don't have any width to them. So when in doubt, go really wide with their legs. So to recap, the M position is what we're looking for when your baby is in the baby carrier. The M position is the position of your butt to hips to knee ratio. So the butt is low, the hips are low, the knees are bent and hiked up, and that's what's kind of making that M position. This position is gonna protect your baby's hip joints the most than any other position. So nice and wide, we're not straight down and dangling. We need a lot of support, and we want that butt supported also. So the next thing I want you to remember is the acronym TICKS, so TICKS. Now, this is gonna help you when you're putting your baby in. It's kind of like a mental checklist you can go through until you're comfortable with it without having to go through the checklist. So the T in TICKS stands for tight. So everything should be nice and tight. It's sometimes counterintuitive and you think you're hurting them or they can't breathe or any of that, but the tighter the better, because that equals a lot of support. The I is for in view at all times, particularly their face. So since we're doing a nice tight and support hold, we want to make sure that their face and other important structures are clear and that we can see them at all time. So Prince Carlos, I can see his face at all time, as opposed to in here, I can't see his face. So therefore some airways might be blocked and things like that. So you really want to make sure their face is in view at all time. The C is close enough to kiss. That means that their head is close enough for me to kiss. And this is important because if they're sitting too low, where you can't kiss them by just kind of looking down, then they're too low. That's a lot of strain on their hips, but also that's a lot of strain on you too. So the higher they are up on you, the more support they're getting, but also the more support you're getting too. So if they're too low and you can't kiss them, then readjust. Okay, so the K in the TICKS acronym is keep the chin off of the chest. And that means off of their chest. So I'll show you here. If Prince Carlos's chin is coming to the chest, to his chest, there's risk in blocking that airway. So again, it kind of all goes with the in view at all times. I can't see him. I want his chin nice and open and off his chest and to the side. And then the S stands for supported back. So we want their back supported at all times. Again, if the carrier is too loose, then that's where you kind of get into a little bit of trouble with not enough support and their back is not supported. Or if the carrier is low and they're higher, that's when you can get a lot of unsupported back support. And then of course, you get into trouble when you bend over a little bit. Remember, these are newborns and infants where they sometimes don't have a lot of head control or trunk control. So we really want their back supported at all times. The next thing I want you to really pay attention to is that size chart. So the size chart that comes with the individual carrier is really important and there for a reason. So they go based off weight and height. This is going to delineate if there need to be forward facing, back facing, things like that. So don't forget to pay attention to that size chart. So another thing I want you to pay attention to is the time that they're spending in here. Obviously, this is really convenient for mom and it's kind of fun for baby. They get to kind of be a little bit more mobile, but nothing beats floor time. So this is not going to replace floor time. So I want you to make sure that you're getting more floor time than carrier time. That's gonna help build all of the skills for tummy time, crawling, rolling, and everything in between. Ideally, you don't want your baby in this baby carrier for longer than an hour. Remember, the joints are fragile. They're not completely developed yet, so they do need that floor time spent outside of this carrier, outside of this device. Hey guys, I hope this helps when you're using a baby carrier or when you're thinking of purchasing a baby carrier. There's so many and most are really good. You just have to be diligent about what we talked about. So the M position, the TICKS acronym, and that time. So that's it for me. Don't forget to follow me on all social media channels. I'm TheBabyPT on all socials. Don't forget to like and subscribe. If you have any questions, leave them down below. I'd be happy to help. Until next time, this is Dr. Olivia signing out.